Then you got liquid gold and liquid silver, nano, liquid gold and liquid silver. Can you talk about that?
Yeah, so either of those have their own photodynamic properties and they're also called, let's say, colloidal gold or colloidal silver. Same thing,
Okay.
nano gold, nano silver. So there's some brain benefits, there's some cognitive benefits, anti-inflammatory benefits with the gold, and again, it has its own set of photodynamic properties. Same thing with silver, except that has some more, let's say, antimicrobial properties, some wound healing properties, and then its own set of photodynamic properties. So since we're kind of building it around this mitochondrial health concept backslash red light therapy synergist, we just wanted to add some ingredients that would enhance, again, the target towards mitochondrial health. And for those that want to use methylene blue with red light therapy, adding that gold and silver would also enhance some of those photodynamic properties.
I love that. It's so cool. We're like little photosynthesizing beings.
Truly.
I tried to tell people that when I was back in medical school. I was running around in 2008 telling people that our mitochondria photosynthesize, and they all laughed at me.
Wow.
They all called me names. I didn't have the science. I just knew it. I was like, based on what I understand. So mitochondria are bacteria, guys, for everyone listening. People don't realize that mitochondria are symbiotic bacteria that live in our bodies that we would die without in milliseconds. So that's crazy. And when I learned that, I wrote a whole paper on it. I was like way ahead of the
Wow.
curve, Mike. I wrote a paper about mitochondria when I was in undergrad, like in the early 90s. I was
What?
writing about, because I was blown away that mitochondria were bacterium. I learned it in one of my basic science classes. And then I wrote another. That was like, check, that was an early adapter on that one. There were a couple other things I did that sort of like prefaced my life coming. But anyway, I'm looking right now. So I mentioned the SIRT1 pathway. For folks who don't know, it activates mitochondrial signals and pathways, regulating the expression levels of genes crucial for the proliferation and ATP production. And then I looked up methylene blue, and it does activate the SIRT1 pathway. So that's pretty rad, because that whole pathway, I just did a podcast about fatty liver, and that whole pathway is really critical to fat deposition in the liver, or keeping it safe, actually. So when that pathway goes sideways, we start packing on fat, and we specifically start packing on fat in the liver, which is not good. For anyone who hasn't listened to that episode, go back and listen to it. So this means that potentially, and I'm looking at this study right here, that methylene blue may actually help with fatty liver and through that pathway, which is really cool. So
Mm-hmm. Well,
we're
another
not talking
huge,
about promoting or treating anything, but it's just nice to know how we can
right.
support certain pathways.
Well, and
Go ahead.
also one of the biggest things about methylene blue, and I don't know if you know this yet, Dr. Tina, methylene blue was the first pharmaceutical drug ever,
I think I did know
and
that.
is as an anti-malarial, and this is back in
Yeah.
the late 1800s. So it's a major, major antiviral, profound results. I mean, there's some case studies of people getting cured in 48 hours with like a dose or two of methylene blue, just like a dose you or I would take. Nothing huge.
Wow.
And so then it's powerful when you combine red light therapy and methylene blue for like the West Nile virus, Ebola, Zika, herpes, hepatitis A. So as far as like an immune boosting, or if you want to call it an antiviral, it's extremely, extremely powerful by itself, but even more so when you combine it with red light therapy.
Well, and it's antibacterial too. At my age, I'm heading on to 50, and there's definitely some cognition issues happening. I don't know, it's perimenopause. Who knows what it is, but it's definitely a thing and I only notice it because I'm a really high functioning academic. Like, I am a high functioning, high brain person. I've always had a lot of pride in that. And so I don't think most people notice their cognition wavering, because most people aren't actually trying to perform at a really high level cognitively. I'm not dissing anyone. It's just, unless you are actively in that world, you don't notice when your brain isn't working like it used to. So I've noticed that. And I know that methylene blue really helps me with that. It's something I cycle. I cycle everything. I don't stay on anything for an extended period of time. I always cycle stuff. And however many months I cycle depends on what I'm doing. Usually it's like 90 days on, a month off, whatever, because I want receptors and everything to be clean. But The other thing I've noticed in this age group is as our estrogen is dropping, a lot of women will end up with vaginal atrophy. It's super common. It gets worse with stress. And that vaginal atrophy can be treated very successfully with some topical estrogen, but that's a pain in the ass. But it's still a necessary treatment that I think most women they're having withheld. They're not getting that discussed by their doctor with them. And so they end up with this sort of low grade chronic UTI thing that persists, especially if they remain sexually active, which I hope they do. So I love methylene blue because I've always had UTIs. Like once you have a bad UTI, you're kind of prone to them for life. It sucks. So I have a propensity for them. And the thing I've noticed about taking methylene blue regularly is that absolutely no concern with that. Like it staves off UTIs, and it's shown in the literature to do so as well because it's so antimicrobial. So
Yep.
Plus adding in that, I mean, colloidal silver is another one that I use for that. So that's an awesome side effect. Ladies, if you're listening, I know that a lot of the listeners to my show are my age, they're middle-aged women or older. Go get your doctor to hand you some topical estrogen for your vagina and for your vaginal tissue so it doesn't atrophy and shrink away. That's terrible. Well, because it leads to chronic UTIs for a lot of women. They don't realize what's happening, and those can go systemic and kill you. People don't realize this. A lot of old people die of UTIs, and the older you get, for some reason, the less symptomatic you become. So a lot of folks in my practice, I took care of a lot of geriatric folks, and they had no idea they even had a UTI, men and women. So all that to say, methylene blue is a wonderful cognitive protector, and it'll give you this awesome side effect of helping you not get potentially viruses and bacteria systemically, but also urinary tract health. So that's a good one. We like that. That's my side rant. Unrelated.
That's a good rant, though. That's a good rant.